Hi, I'm Dr. Bill Berkowitz of Life Chiropractic in Grass Valley. Today I want to talk to you about the 4 critical steps to a successful chronic headache treatment program. The fact that your headaches might be chronic, meaning that you're experiencing them on a regular basis, that may be multiple times a week or at least weekly or 2 or 3 times a month, would define chronic. There's 45 million sufferers of chronic headaches in the United States, so you're not alone. I know that probably doesn't make you feel any better. So let's talk about this. Once you have a problem that's chronic, by definition, it's almost always multifactorial. And what do I mean by that? Is the longer you have something, the more your body tries to compensate and adapt to it, and that puts layer upon layer of challenges into the problem. So it's not necessarily as simple, or really as simple, as it might have been to address when the problem first started. So I look at this as 4 steps. When someone comes into my office and their primary issue is chronic headaches, I look at 4 things, and we work on these 4 things as we move through care, in addition to some other things, but these are the primary things that show up with everybody. The first, I look at the cervical curve. That's your neck. Your neck should have a curve, and see, your neck is a rather thin area that holds up an 8 to 10 pound weight that we call your head. Every inch that the head moves in front of the shoulders effectively adds another 8 to 10 pounds to the weight the muscles of your neck are holding up. Any loss of the curve of your neck puts additional stress to the bones and starts to create a wear and tear arthritis over time. That only irritates nerves further and complicates the headaches. So that's step 1. Step 2 is I put particular focus on the upper cervical spine, the area in the top 3 vertebrae. That's where your brainstem lies. Why is that important? Your brainstem is home to your autonomic nervous system. That's the part of your nervous system that regulates all the functions of your body that go on without your conscious awareness. Specifically with respect to headaches, it regulates muscle tension, relaxation, heart rate, breathing rate, sleep, digestion, and on and on. So we want to make sure that the upper cervical spine is lined up and is moving properly, so we take pressure off of the nerves. Also, the vagus nerve runs right in front of the first cervical vertebra, and the vagus nerve is your pathway to wellness. If your vagus nerve is not working well, then you're going to have increased tension and pain through your neck and shoulders. You're going to have increased inflammation. And those are the things that specifically apply to headaches. The third step is looking at overall body balance. I want to make sure that your pelvis is level. I want to make sure that your head is level and your shoulders are relatively level. If they're not level, then your body is working all the time to try to maintain you in a state of as much balance as possible. This puts tension on the muscles. And even though we might be looking at the pelvis, that tension goes up the spine all the way to the top of the neck, and that can be responsible for headaches. In the upper neck, in addition to the brainstem, we have 3 pairs of nerves on the right and 3 nerves on the left. They are the suboccipital nerves. They go into the back of the head, all the way to the forehead and into your temple. Any pressure or irritation to these nerves due to imbalance is one source of headaches. That's often the source that they refer to as a cervicogenic headache, but the neck goes much further in its involvement. And the 4th step with everybody experiencing chronic pain, and especially headaches, is we want to raise the activity or the tone of the vagus nerve. I've already mentioned the vagus nerve. The vagus nerve will help promote proper sleep and rest, which is conducive to more relaxation and greater healing. It will help reduce inflammation. It's going to lower your heart rate and blood pressure, which will also promote greater ease and relaxation and safety within your nervous system. So those are the 4 critical steps to a successful chronic headache treatment program. There are more pieces to it, but those are the first 4 steps that I look at with everybody. I want to make sure that you subscribe to my social media channels where I post great information on a regular basis. Also, you can find information on my website, lifewithinchiropractic.com. And if you go there, there's a scheduling link if you'd like to schedule an appointment with the office. Thank you. Have a great day.